This is Sumathi Govindarajan, Head, Department of Anatomy. I am specialized in the field of anatomy with 2 decades and I have guided many projects under my guidance and 2 more projects are on process. I am a life member of Association of Anatomists, Tamil Nadu Chamber. Today we are going to see about the cranial cavity. So, before going into the detail about the cranial cavity, we have to go through how we have to study or how we have to divide the views of the skull. So, if you are seeing the skull in front, that we call it as norma frontalis. So, we can see all the features present in the anterior aspect. If you are going to view the skull posteriorly, that is called as norma occipitalis. If you are going to read the lateral aspect, we call it as norma lateralis, and we go for the superior view, that we call it as norma verticalis. And the base, that is the inferior aspect of the skull, we call it as norma basalis. After cutting the vault, we will be able to see the cranial cavity. This cranial cavity, here we can call it as base of skull or the interior of the skull. So, to be noted before, a general point what we have to say is, what is pericranium? Pericranium is a membrane which is going to cover the outer surface of the bone or cranial bones. Okay. Normally, the membrane which covers the bone, we call it as periosteum. As it is covering the cranial bones, we call it as pericranium. So, interior or the internal aspect of the bone will be covered by the another membrane called as endocranium. So, these two will be coming in together, meet each other in the process where there are sutures are present and wherever there are foramens. So, in the point they will be connecting, the pericranium and endocranium will be meeting at these 2 points. The thickness of the cranial cavity will varies. Whereas, if you go for the weight of the skull, in female, the weight of the skull is very less compared to the adult or male. So, here when you come for the structure, the bone, the calvaria or the cranial vault is made up of compact bone. Compact bone consists of outer table and inner table. Outer table is thick when compared to the inner table. Between this outer table and inner table is the presence of spongy bone, which we here call it as diploe. The inner table, as it is very thin, it will give impressions of the structures whatever present within the cavity. Cranial vault. So, what is cranial vault? Cranial vault is otherwise we call it as skull cap or calvaria. Okay. The inner table, as the inner interior means we have to see for the inner table. So, the inner table, as it is very thin, it gives impressions of many structures or bony markings like meningeal vessels. The meningeal vessels which enters through the foramens will be supplying the meninges. So, they give an impression over there. Here in this diagram, you will be able to see the groove for anterior branch of middle meningeal artery and posterior branch of middle meningeal artery, giving branches, showing the branches of the meningeal vessels. Next is cerebral gyri. Cerebral gyri means the cerebral hemisphere will be having an elevation and depression. The elevation is called as gyri and the depression is called as sulci. So, the cerebral gyri will give an impression over the inner aspect of the calvaria. Next is venous sinuses. Venous sinuses means they are the venous blood present within the cranial cavity. The inner aspect what we say before is the endocranium, that is a part of dura mater. The outermost meninges of the brain will be the dura mater. This dura mater can be divided into an endosteal layer and a meningeal layer. Meningeal layer will be covering the brain, whereas the endosteal layer will be covering the inner aspect of the calvaria. So, these two membranes will be intact together in overall surfaces, but at some places these two membranes will be divided. That is, the 2 layers of the dura mater will be divided, which is going to enclose the dural venous sinuses. That is going to give an impression over the surface of the bone. The next one is the granular foveae, or that is arachnoid granulation. That is nothing but the a protrusion of the subarachnoid space along with the arachnoid matter entering into or protruding into the dural venous sinuses. That is, we are referring it as granular foveae. So, you can see the round structures, round depressions over the inner aspect of the calvaria. Then apart from this, a bony ridges can be seen. One we see here in the diagram is the frontal crust, which is present in the midline on either side of the 2 frontal bones. And next, if you see here in the midline, you will be able to see an elevation with the groove in the center. This groove is for the superior sagittal sinus. On either side is raised one, that we call it as sagittal borders. Then here we are able to see the granular fovea and the frontal crust, everything here. Okay. So, how we are going to read the cranial cavity? The cranial cavity can be divided into three parts as anterior cranial fossa, middle cranial fossa and posterior cranial fossa. If you see this fossas, the most shallow one will be the anterior cranial fossa, whereas the posterior cranial fossa will be the deepest one. This anterior cranial fossa is made up of the frontal bone, the ethmoid bone and the sphenoid bone. The middle cranial fossa is formed by sphenoid, temporal and parietal. The posterior cranial fossa is formed by sphenoidal bone, parietal bone, temporal bone and occipital bone. So, all this, the frontal, ethmoid, sphenoid, temporal and parietal bone, occipital bone will be forming the, there is a partition of this cranial cavity. Anterior cranial fossa. If you go for anterior cranial fossa, what is the bones forming its boundary? Here, the boundary laterally, anteriorly as well as laterally, it is formed by the frontal bone. The posterior boundary is formed by the free margin of the lesser wing of sphenoid. This lesser wing of sphenoid extends backward as a process or a projection called as anterior clinoid process. This anterior clinoid process will divide into two roots as anterior and posterior root, which is going to attach to the body of sphenoid, enclosing a small foramen. That is the optic canal. So, behind that we will be having an anterior margin of the sulcus chiasmaticus. Sulcus chiasmaticus is the area where the optic nerve cross each other. Actually, the crossing is not happening in this position, but it happens in the higher level. Next, what are the bones forming the floor? First one is the orbital plate of frontal bone. This orbital plate of frontal bone is a part of frontal bone. There is a horizontal part. The vertical part will be called as squamous part. So, within this, it encloses a frontal asinus. Next one is the cribriform plate of ethmoid seen in the midline. So, this cribriform plate of ethmoid will be porous in nature, which is present here. There is a cribriform plate, and behind that, still more behind that, is the jugum sphenoidae, where the body of sphenoid is present, separating it from the sphenoidal asinuses. So, these three bones forms the floor of the anterior cranial fossa. What are the features we have to see in the anterior cranial fossa? The first one in the midline, if you see, is a frontal crust. A sharp line or a ridge is seen on the midline called as frontal crust. Behind that, there is a depression called as foramen caecum. Still more posteriorly, we have a porous nature of bone, a thin plate of bone called as cribriform plate of ethmoid. So, these porous nature cribriform plate will divide the bone from the nasal cavity from the cranial cavity. So, these openings, small numerous opening is for the olfactory nerves which enters the nasal cavity. So, this cribriform plate of ethmoid articulates anteriorly with the frontal bone and posteriorly with the sphenoid bone. When it is articulating with the frontal, that is in the fronto-ethmoidal suture, and here near that point we will be able to see a foramen called as anterior ethmoidal foramen. And posteriorly, it articulates with the body of sphenoid. There laterally, posterolateral to that articulation, we will be able to see another foramen called as posterior ethmoidal foramen. These two foramens offer the ethmoidal nerves and vessels. Next, coming to the middle cranial fossa. So, the boundary for middle cranial fossa, that is the posterior boundary for the anterior cranial fossa will form the anterior boundary for the posterior cranial fossa. So, again here we see lesser wing of free margin of lesser wing of sphenoid, anterior clinoid process and anterior margin of sulcus chiasmaticus. These forms the anterior boundaries. Posteriorly, it is bounded by superior border of petrous part of temporal bone and dorsum sellae. Dorsum sellae is a projection, upward projection from the body of sphenoid, and they end laterally in the posterolateral aspect of this projection, dorsum sellae, we have posterior clinoid process. Then between these two, the floor of this bone or the walls of this middle cranial fossa is formed by greater wing of sphenoid anteriorly, still more behind by the squamous part of temporal bone, and still more behind will be the anterior inferior angle of the parietal bone. So, these three bones will form the floor and the walls of the middle cranial fossa. What are the bones forming the floor? So, here the floor is formed by in the midline by the body of sphenoid and laterally by the greater wing of sphenoid and still more posteriorly will be the squamous part of temporal bone and the anterior surface of the petrous part of temporal bone. All the 4 bones forms a floor. So, this is a diagram again showing the lateral boundary. So, the first one which is present anterior is the greater wing of sphenoid. Next behind that will be the petrous part of temporal bone, and superiorly will be the parietal bone. So, what are the features we have to see in the middle cranial fossa? So, first if you see here in the median area, we have a jugum sphenoid is a body of sphenoid, we have already seen. Behind that we will be able to see a area what we call it as sulcus chiasmaticus. So, that is what already we have mentioned, that the optic nerve will be crossing here below this level. Next is the optic canal. So, the 2 roots of the anterior cranial fossa, when it is articulating with the sphenoid bone, will form this foramen, that is optic canal, which leads from the cranial cavity into the orbital cavity. The next ridge which separates the sulcus chiasmaticus and the hypophyseal fossa is the tuberculum sellae. Next, behind the tuberculum sellae is the presence of a small depression which we call it as hypophyseal fossa or pituitary fossa. And still more behind is the dorsum sellae along with the posterior clear process. The tuberculum sellae, the hypophyseal fossa and the dorsum sellae together, all together we call it as sella turcica. This is the lateral area of the middle cranial fossa. So, first we have to see about the superior orbital fissure. It is a fissure which communicates the middle cranial fossa with the orbital cavity. It is long axis is the long axis is directed laterally, and the medial part of this superior orbital fissure is wider when you compare the lateral one. Behind the superior orbital fissure is the presence of foramen ovale. Foramen ovale is oval in shape, which is going to communicate with the infratemporal fossa. Between superior orbital fissure and foramen ovale, there is a presence of another foramen called as foramen rotundum, which will not be visible in the basalis. So, this is the one which is going to communicate with the pterygopalatine fossa. And the next foramen is the foramen lacerum, which will be seen on either side of the body of sphenoid and the apex of the petrous part of temporal bone. This will be grooved by the carotid groove. Then behind this, at the apex of the petrous part of temporal bone, there is an oval shaped impression which we call it as trigeminal impression, where the trigeminal ganglion is present. Next is after this apex, if you go behind laterally, you will be able to see an elevation called as arcuate eminence in the petrous part of temporal bone. This arcuate eminence is formed by the anterior semicircular canal of the internal ear. And still more posteriorly and posterolaterally, we have a thin plate of bone called as tegmen tympani. And here that is in front of the petrous part of temporal bone, we will be able to see 2 grooves called as groove, or there is a sulcus, small, very thin small sulcus, which we call it as hiatus for lesser petrosal and greater petrosal. The greater petrosal hiatus will be very much nearer the petrosquamous fissure, which opens into the foramen lacerum. The hiatus for lesser petrosal will open into the foramen ovale. The third one is the posterior cranial fossa. The boundaries will be the anterior boundary for this posterior boundary for the middle cranial fossa will be the anterior boundary for the posterior cranial fossa. So, here we have the superior border of petrous part of temporal bone, dorsum sellae. This is the anterior one, and posteriorly will be the squamous part of the occipital bone. And on each side of between these two will be the presence of mastoid angle of the parietal bone as well as mastoid part of temporal bone. These bones forms the boundary for the posterior cranial fossa. The floor is formed by, there is a sloping anterior to the foramen magnum, which we call it as clivus. This clivus will be related with the structures like pons and medulla as well as basilar plexus of veins. And still more behind in the midline will be having the foramen magnum. The foramen magnum is wider in the posterior aspect than when you compare with the anterior aspect, because the occipital condyle will be diverted medially to lessen the diameter of the foramen magnum. Still more posteriorly, we have the internal occipital protuberance, which is opposite to the external occipital protuberance. And here next on the lateral side, we have a area called as condylar area. that is a part of occipital bone. Still more laterally, we have the posterior surface of the petrous part of temporal bone, the sigmoid sulcus, as well as the parietal bone, that is inferior angle of the parietal bone. All these bones will form the floor of the posterior cranial fossa. So, in the median area, what are the features we will be able to see? First one is the clivus. So, as I said before, the clivus will be related to the pons and medulla as well as basilar plexus of veins. This point is formed by the body of sphenoid articulating with the basilar occiput, and the foramen magnum, the largest foramen of the base of skull, and behind that will be the internal occipital protuberance and internal occipital crust. So, internal occipital crust will be as a single crust. When you have followed it downwards, it will be deviating towards the margins of the foramen magnum, enclosing a small area called as vermian fossa, where the vermis is related. On the lateral side, we will be able to see the jugular tubercle. Jugular tubercle will be easily identified above the occipital condyle. And the next one is a hypoglossal canal, which will be seen in front of anterolateral part of the foramen magnum. And in the petrous part of temporal bone, posterior aspect, we will be able to see the internal acoustic meatus. And here behind this internal acoustic meatus, there is a small slit which we call it as aqueduct of vestibuli, so which is be opening into the internal ear. Then behind that, below this jugular, there is internal acoustic meatus, we have the jugular foramen, a large horizontally elongated foramen present here, which is divided by the jugular spine. And behind this jugular foramen, we will be having a S-shaped sulcus called as sigmoid sulcus. This will be the continuation of the transverse sulcus, which will be seen on either side of the internal occipital protuberance. So, we have seen all the foramens in the base of the skull, that is starting from the foramen cecum, then the cribriform plate of ethmoid, and then optic canal, superior orbital fissure, foramen rotundum, foramen ovale, foramen lacerum, foramen spinosum, internal auditory meatus, jugular foramen, hypoglossal canal, and posterior condylar canal. There are one more foramen which we call it as emissary foramen, which will be present anterior to the foramen ovale. That is called as foramen of Vesalius. That if it is present, it will be transmitting emissary vein. So, starting from this foramen cecum, next will be a that will be a patent, and then the second one is the cribriform plate of ethmoid, where the olfactory first cranial nerve gives the olfactory nerves. In the optic canal or through the optic canal, the optic nerve emerges, which is the second cranial nerve, and then forms the chiasma over the chiasmatic sulcus. The superior orbital fissure will give passage for the third, that is oculomotor, trochlear, and abducent, third, fourth, and sixth, and the first division of trigeminal, that is the fifth one, that is ophthalmic division of trigeminal. So, the superior orbital fissure will be passed, that is the third cranial nerve, the fourth cranial nerve, first part of, that is ophthalmic division of trigeminal, and abducent will be passing through the superior orbital fissure. Behind the superior orbital fissure, we have the foramen rotundum, which is where it is going to give pass by the second division of trigeminal, that is the maxillary division of trigeminal nerve. Behind that is the ovale give for the mandibular division of trigeminal, and through spinosum, we have the middle meningeal artery will be emerging from the infratemporal fossa and comes to the cranial cavity. The internal auditory meatus will give passage for the 7th and 8th cranial nerve, that is the facial and vestibulocochlear nerve, along with the labyrinthine artery. The jugular foramen will give passage for the 9th, 10th, 11th, that is 9th is glossopharyngeal, vagus, accessory vagus. And the hypoglossal canal or the anterior condylar canal will be passing through that will be the 12th cranial nerve, that is the hypoglossal nerve. So, these are the structures related to the foramens whichever is passing through it. That is about the cranial cavity. So, in the next class we will see about the other part of the skull region. Thank you.